Welcome to Techstination, your destination for gadgets and gear. Here's Fred Fishkin.
How can AI help to provide medical care where it is needed most? Joining us from SRI International, a nonprofit research institute in Princeton, New Jersey, is Program Director Jason Tyan. Hi, Jason.
Hi, Fred. Nice to meet you. It's my honor to join your program.
Well, a pleasure to meet you. Let's talk about the problems and what the research you're doing with the Advanced Research Projects Agency for Health under HHS is focused on.
Okay. So this program is called Paradigm under the Upper Edge sponsored program. So the idea under this program is we're trying to develop a so-called care delivery platform. And we're going to deliver, high quality hospital clinical service that can be deployed in the rural area or any kind of underserved communities. So this program, basically, our idea was trying to develop the system. This system includes like a mobile vehicle, and this mobile vehicle could carry with the different kind of medical device and allow the clinician or the healthcare worker to perform different clinical service within this mobile equipment. And they can drive it around in the country and the server, to provide a service for those people who cannot have the clinical access in their local community. So this program, and we all understand, currently the healthcare shortage is very serious. And if we would like to have this program, we still will require the healthcare worker. They can perform the different kind of procedure with this CDP or care delivery platform. So the idea is we were trying to use the AI system to help the upscale the user skill set, which means allow the user to perform the different kind of procedure from the phlebotomy to the ultrasound scan, and also doing some of splinting procedure. So in general, those type of the service will require specialized training in the hospital, and they are required with different kind of skill set. However, due to like in the rural area, we don't have this kind of different kind of people and training, and how we can do that. And we will likely rely on AI and hope that AI to help each person to perform this variety of the procedure. So the same person, even they don't have much training or the training is with less training, and with the AI support, they can smoothly and accurately to finish all the clinical service in this the vehicle, mobile vehicle environment.
So what does this guidance system consist of, and how is a clinician on the scene? How do they take advantage of it? What are they told? How were they guided?
Okay. So this guidance system, we basically provided two major types of the guidance. One is we call the proactive guidance, which means the system, the AI will basically monitor or look at the user's behavior or the action. So during the entire procedure or process, the AI will understand user at which step, and if that step that the user performs is correct or incorrect, and they will basically provide a warning or give the guidance. If they do the incorrectly, then we'll tell the user there is error happened during your process, and guide the user how you're going to correct your error and make the procedure accurately. So that's one kind of guidance. The second of the guidance we call the reactive guidance. The reactive mode means the user have any kind of questions, they can ask the system. So it's like the chatbot, or we call the co-pilot. So the AI system will respond to any kind of questions the user may have, and provide not only the speech result, but also showing the graphical result to guide the user to perform the step by step. So if they have some issue running to, they want to get some expert support, so AI could be seated next to the user and provide this kind of guidance.
So it's a computer system with a camera that's providing the guidance as a clinician goes along?
Yes. Basically, we have a camera, and the people can also wear the smart glass as well. So basically, the AI will take the input from this perception information, and also monitor, also listen from the audio channel if the user have any question or any kind of conversation between the user and the patient or the environment. So the AI will combine this information both with the video and audio information in order to provide the guidance.
And is the system going out to the cloud, or is it all local on the computer?
Well, that's a very good question. So think about this mobile system is going to drive it around the country. And we have to assume the internet connection will sometimes could be very bad, or even there's no internet connection. So all our system will be running on local and using the local computer. So basically from our design, since day one, we basically assume, this is the kind of environment we have to work on and make all our model work on the local system. So currently we don't use or rely on any kind of cloud computing or, to access any kind of cloud resource.
Even though the capability of using satellite-based internet is growing more feasible all the time, right?
Yes, but this will be actually on our development roadmap in the future. If the internet access is through like Starlink or or satellite link, and we can leverage, but still you will be limited by the some of the bandwidth issue, and also we have to consider the latency because when you sense a lot of the video data, this need to be processed and provide the reasoning quickly in real time. So this is the only thing we expect it should be done locally rather than remotely using any kind of the cloud service.
Very interesting. So step us through a scenario here where this would be used, and tell us about the economics of this.
Well, the economic benefit will be huge and tremendous, right? So think about when we train the healthcare worker to specialize the certain procedures that we're going to take years of training, right? And right now you can ask the people to work with a multiple procedure with the minimum training. And this could really accelerate, the deployment for the user's experience. And we can quickly have the huge amount of the resource to be available and support the rural area. And the other things that using this AI, not only trying to upscale the user's skill set or their experience, the most important is to use with this kind of support system, we can mitigate or reduce the error because we all human, right? Human could easily make a mistake or they can forget something. And with the AI support, they can constantly monitor the procedure and provide you the guidance and tell you if you make a mistake. Even with the experienced person, right, this mistake still could be inevitable. And by using the AI, we can also improve the accuracy about the procedure.
So what do you envision, more or less like an RV kind of scenario or a van?
Yeah. Currently, we are building like the van. This is actually like an electrical vehicle. It will be like like min-sized type of van. And this van could be, is charged in a day, at least allow the power to provide then they can drive it around at least for 8 hours for at least for the 1 day service before they come back to the base and recharge. And during this day, they have to provide all the electricity to support the procedure, and also that our computer is also rely on with this kind of electrical power, from the vehicle.
So what happens next with deployment of these vehicles, this program?
Okay, this program right now is a 5 years program. We are in the year 2 right now. We already started building the prototype. So there already have 2 different kind of design and the prototype available. So I think by end of this year, we're going to start at least to conduct some testing, the field testing. And then we're going to, based on the field test, then we have to probably improve and make this more robust and also adjust, some of the issue, during this test event. So hopefully by the end of this program, we have several, vehicle to be developed and they can start to, provide the service to the community.
And going forward, I mean, we talked about the need in rural areas. but there are many scenarios where I guess this could be helpful after disasters, for instance, for one, unfortunately, military situations for another. Tell me what your thoughts are about the need for this going forward.
I think the demand is very, very strong. And since we started this program, we already received very high attention, not only from the federal end, but also most likely on the state end as well. And the state right now, they also have the huge program opportunity. They want to deploy this program and to support their local community. So we really gained a lot of attention, from the nationwide. And there's already several states like Midwest, Minnesota, Wisconsin, and those kind of the state is actively asking about the system when it could be available. And we also envision this not only could be used for the rural healthcare area, but there could be also extend, like for example, like our provider task guidance system. This could be also benefited for even like hospital level, right? In the hospital system, we can also provide this kind of service as well, to provide the guidance to support our the medical healthcare worker their training. And also in the military as well, right? The military, you could also be benefited in using this kind of guidance system to reduce their battlefield casualty.
And I assume in the educational realm as well, as people are learning, clinicians are learning skills, this could be utilized there too, right?
That's right. That's right. Yeah.
For more information, where can people go?
Well, they could, go to, there's a couple of the channel and they can look at this program. Of course, the Upper Edge, the Paradigm, there's definitely the one open channel. And also we have the news channel at the SRI International, and we'll have also provided some of the further information for this program.
Well, congratulations to you and the team there. Jason Tyan, thank you so much for spending time with us.
Thanks, Fred, and thanks for having me. It's my pleasure and talk to you. Thank you.
Thank you for watching or listening. Don't forget to subscribe. And for more, you can find us at Techstination.com.
The Haven 10,000 lantern is a smartly designed, beautiful solar light that you will love indoors or out. It is waterproof with up to 1,200 lumens of brightness, that's a lot of light, and the base becomes a flashlight at the push of a button. The power comes from a built-in lithium-ion battery recharged by the sun, the solar panel is built in, or USB-C. The battery can even recharge your phone. Did we mention how durable it is? How it folds down and can run for up to 120 hours on a charge? But the real power of the Haven Lantern comes from the people behind it and their mission to provide this quality lighting to those in the world who need it most, including in disaster emergencies. Your purchase helps to fund those efforts, and if you use the code Techstination20, you'll get it at a 20% discount. That's Techstination20 at havenlantern.com. Create your haven.